In this video, we will be discussing the Erhardt Developmental Prehension Assessment, otherwise known as the EDPA. The EDPA is used to assess components of arm and hand development in children. It can also be used to identify children's intervention needs, help modify programs with ongoing assessment, and provide accountability with retesting. The Erhardt Developmental Prehension Assessment is an observation-style assessment because the assessor observes the child in a certain position, or the child is presented with a stimulus and their reaction is observed and recorded. It assesses hand function. This assessment can be used with children who have cerebral palsy, multiple disabilities, or developmental delays. It typically takes 1 to 3 hours to complete, and the short form, the EDPA-S, takes 30 to 60 minutes. Section 1 and 2 assess prehension patterns and can be used for children from birth to 15 months. The third section assesses drawing and writing skills and can be used for children 12 months to 6 years old. Part 1 and 2 look at the ICF domain of body function, and Part 3 looks at activity. To do the EDPA, you need a graded series of 3 dowel shapes, approximately 1 to 2.5 centimeters in diameter, a graded series of 3 cube shapes, approximately 3 to 6 centimeters wide, a graded series of 3 edible pellets, approximately 5 millimeters to 1.5 centimeters in diameter. Typically, rice puffs are a good option to use. A graded series of 3 large containers, approximately 5 to 8 centimeters wide, and a graded series of 3 small containers, approximately 1 to 3 centimeters in diameter. You will also need a pencil, a crayon, segments of black and white yarn, thread, and the test kit container. This assessment has 3 parts. The first part is made up of formal test items and is divided up into 3 sections. Section 1 looks at involuntary arm-hand patterns, Section 2 looks at voluntary movements, and Section 3 looks at pre-writing skills. In Part 2, the assessor translates the scores into developmental levels, and in Part 3, an overview of the child's function in terms of involuntary, voluntary, and pre-writing skills is created. Scoring is broken up into 2 parts. The first part is the pattern component. These are the smaller boxes on the right-hand side of the pictures. If the box is shaded, it means that this pattern will remain present throughout the child's life. And if the box is not shaded, it means the pattern should not continue throughout the child's life. To score these, the assessor looks to see if the pattern component is present. It may take several attempts to actually see what movements are present. If the pattern is normal and well integrated, you would place a plus sign in the box. If the pattern is not present, you would place a minus sign. If the pattern is emerging or abnormal and not well integrated, you would place a plus and a minus sign. If the transitional pattern is replaced by more mature patterns, you would place 2 plus signs in the box. If intervention is needed, the box is then circled. Both the right and left hand must be tested for each item. After all of the pattern components are assessed, the developmental levels need to be determined. The developmental levels are the larger boxes to the left of the pictures. If all of the pattern components are present, a plus sign is placed in the box. If no pattern components are present, a minus sign is placed in the box. If some, but not all, pattern components are present, a plus and a minus sign should be placed in the box. And if all the pattern components were replaced by more mature patterns, 2 plus signs are placed in the box. If the pattern component box is shaded and it is scored as a plus, the developmental level should be transferred as 2 plus signs. This is because the pattern will continue throughout the child's life and it cannot be replaced by a more mature pattern. After the 3 sections in Part 1 are complete, the developmental levels for each subtest in each section are transferred to the score sheet in Part 2. Finally, the assessor must estimate the child's range of developmental levels and record them on the score summary sheet in Part 3. In this demonstration, the child will be demonstrating 3 different age groups for each section of the assessment. Items in Section 1 will be for a 2-month-old, items in Section 2 will be for a 10-month-old, and items in Section 3 will be for a 4.5-year-old. In Item 1B, you are looking at the child's arms at rest during head raising when in prone. You are specifically looking to see if the child's head is above shoulder level, if their shoulders are raised but lower than their ears, if their arms are in ATNR position, if they are pushing up on their forearms with one supinated and one pronated, if their weight is on the palmar surface of ulnar borders, and if their hands are lightly fisted. Here is an example of what you would be looking for. In Item 1C, you are looking at the asymmetrical tonic neck reflex. You are specifically looking to see that the response is immediate, strong, and consistent. For item 1E, you are looking at the placing response, specifically looking that this has been fully integrated. You are hoping that there is no response to brushing the back of the hand lightly against the table. For item 2C, you are looking at the arms on approach. You are specifically looking to see that the child's wrist is extended and they have appropriate finger extension. For item 2D, you are looking at the grasp of the dowel. You are specifically looking to see if the child uses a three-jaw chuck grasp and is holding the object with their thumb and two fingers. For item 2E, you are looking at the child's grasp of a cube. You are specifically looking for wrist extension. For item 2F, you are looking at the grasp of a pellet. You are specifically looking to see if the child uses a pincer grasp and holds the pellet between the distal pads of their thumb and index finger. You are also looking to see if the proximal joint of the thumb is extended and the distal joint is slightly flexed, and that the thumb is opposed to the index finger. For item 2I, you are looking at the release of the pellet. You are looking to see if the release is controlled into the larger container. For item 3A, you're looking at a crayon or pencil grasp. You are specifically looking to see if the utensil is grasped distally, if the form is slightly supinated, if the wrist is slightly extended, if the MCP joint is stabilized during PIP movement, if the ring and little fingers are flexed to form a stable arch, and if there is precise opposition of the pads for the thumb, index, and middle finger. The final item is 3B, drawings. You are specifically looking to see if the child can copy a square and trace a diamond. It was reported that in 1988, Erhardt was in the process of gathering normative data for this assessment. However, this data could not be located. The inter-rater reliability ranged from 0.71 to 0.95. This was based on 16 raters who used the EDPA to score 4 videotaped evaluations. Inter-class correlation describes how strong units from the same group resemble each other. These values ranged from 0.41 to 0.85. The content validity was considered good based on the fact that the EDPA virtually includes all prehension patterns and considers the developmental theory. The correlations between the EDPA and the PDMS was found to be 0.85. There is also a short screening form available, known as the EDPA-S. The EDPA is available in 3 languages, English, Spanish, and Japanese. The assessment lacks clear instructions, and many items require interpretation by the assessor. Many OTs reported not using the EDPA as a measurement tool, but to guide their treatment plan and monitor progress. It lacks the psychometric properties that would be required to be a standardized, objective hand function assessment. Further studies need to be done regarding this assessment's test-retest reliability, internal consistency, as well as construct and discriminant value. Here's the list of my references from the video. Thanks for watching.